allergies in children. First of all, let's have some housekeeping chores. Please feel free to ask any questions. We have two windows in here. One is for you raise your hands, and I will allow you to ask the questions. And the second one is you can send me the text messages. I will be handing both of them. Why we want to know about allergies? Well, first of all, we want to know about allergies because allergy is a very common cause for a lot of chronic illnesses. And number two, why do we really want to know about infants and children? You see, when the baby is born, it's a welcome to the family. Although it's a period of stress also, but happiness and pleasure goes along with that. Now, if that child is not healthy, it creates a lot of stress on the family. For example, a new mother and the baby is colicky, can't sleep at night and wakes the mother up several times. Or as the child grows older, starts having frequent coughs, colds, ear infections, starts having digestive problems, diarrhea, acid reflux, and so on and so forth. So a very happy event, it becomes quite stressful for the family. But if we can recognize these allergies early and treat early, we can take care of the problem much earlier. So this is what my purpose in here is, to give you some clues, and just don't say, well, you know, this kid is prone to ear infection, I have 10 ear infections, what else can I do? Well, you can do a lot of things, you see. So that's what the purpose is. I will go with this first presentation of the case. It will elicit a lot of parts of allergies. This was a 25-month-old Caucasian girl I saw in May of 2017. She had hay fever and eczema, spring through fall, starting in spring of 2016 and restarting in April 2017. So when the mother brought the baby, we made the diagnosis of seasonal atopic dermatitis, that means eczema, seasonal eczema, and hay fever, which was spring through fall. This was the second season that she had. And she had recurrent ear infections 10 times, but nobody ever suspected these to be allergies. And by history, she was sensitive to horse that within 2 or 3 minutes touching the horse, and she would get running nose, sneezing, and itching of the eyes. So we did allergy testing by a special method of allergy testing called serial dilution testing. We'll go into more details. So it showed that she was sensitive to trees and grasses and horse. So allergy treatment, when you can't avoid something, the second part of treatment is that you give the allergy treatment and you start the allergy shots. That's what we did. 3 months later, mother reported that it's amazing how allergy injections are helping with hay fever and eczema. She was advised to return in spring 2018, and allergy injections restarted because it was a seasonal allergy, so there's no point in continuing with the allergies treatment throughout. So in fall of 2018, mother reported that hay fever and eczema remained under control. And she was fine in 2019, so required no treatment. Came back 2020, but when symptom has started, so we did the immunotherapy again. For the allergy treatment, she has not needed any antihistamines like Allegra, Benadryl, and did not need any topical steroids, because typically this is how the problems are treated. See, when you treat the problem with the medications, you're just covering up the symptoms. You're doing nothing to the underlying causes. Okay, now in allergy treatment, we emphasize upon treating a problem without medications. It's because if you can find the cause and treat the cause, you don't need much medications. And we talk a lot about drug-free America, but in real life, there is no drug-free life. 0 to 1, you may have antibiotics. 4 to 12 can get hyperactive attention deficit, Ritalin, and later on episode suppressant, on and on. So things go on with our aim of being drug-free America, but we are really drug full of America. And this is just another cartoon partnering for drug-free America and having a relationship with the drug companies. So let's talk about, why does a patient go to the physician in the first place? Well, because somebody has a problem. May have a problem with asthma or hay fever or sinuses or arthritis or whatever the symptom may be. And typically, these problems are treated symptomatically. If your sinuses, take antihistamines. If you have breathing problem, take the inhalers. If you have problem with headache, take pain medication, etc., etc. Or blood pressure medication. In environmental medicine model, we say that if you look for the underlying causes, you don't need much of the drugs. So here are the common underlying causes for all sorts of chronic problems for which patients go to physicians day in and day out and ruining their lives. Now, we all know how to treat the medical problem. We guess kind of we know how we treat the problem. Well, sinus problems with antihistamines, asthma with puffers and inhalers, and eczema with topic steroids, and arthritis, anti-arthritic medication, and so on and so forth. But that is not the real treatment. That's just suppressing the symptoms and doing nothing to the underlying cause. So what is new that we want to talk about? What we want to talk about is even serious medical problems can be treated without medicines. How? By treating the underlying causes. You see, let me give you one example. If you're in headaches, if you can find the cause and treat the cause, what's going to happen to your headaches? Well, you get rid of the headaches. Well, if you get rid of the headaches, what happens to your medications? Well, you don't need the medication, so you get rid of the medications. When you treat the underlying cause, then what happens to your trips to emergency room and doctors and otherwise? You get rid of that too. You see, so basically, when you treat the underlying causes, you're looking for three critical results: getting the symptoms, getting the drugs, getting the physician, and enjoying a healthy life once again. So my practice is environmental allergy. So what is really environmental medicine? See, environmental medicine is a newly emerging medical specialty. It focuses on dynamic relationship between individuals and environment. What you eat, what you breathe, what you come in contact with, those are the things that make you sick. There's nothing mysterious about people getting chronic illness. And it draws from many fields of medicine for caring for patients suffering from numerous unexplained medical illnesses. Okay. So when we talk about allergies, where do the allergy causes lie? Well, something you eat, something you breathe, something you come in contact with, you see. So in breathing, dust, molds, pollens, animal dander, etc. Food you eat, milk, egg, wheat, corn, sugar, yeast, soybean, chocolate, etc. Things you touch or you inhale also, like chemicals, fabrics, soaps, etc. So let's talk about another case study will point out. 2.5 years old Afro-American girl. She was adopted. I'll tell you why the significant adaptation I especially mentioned in here. Seen in November 2015. Had seasonal allergy, nose, wheezing in spring and fall since the age of 6 months. Often diarrhea, a lot of diaper rashes, thrush several times, hyper, took a lot of antibiotics, 7-8 courses of antibiotics. Current medicine she was taking because she has bronchial problem also, albuterol, pulmicort, those are inhaled steroids, antihistamine. You see, she was born to a mother addicted to cocaine and heroin. So here the adaptation comes that these infants did not have even a good chance of being developed intrauterine if clean environment. And that predisposes them to a lot of allergy problems later on, which we're going to talk about as we progress into the treatment. So we did the allergy testing, found that she was sensitive to house dust, dust mite, moles. And then we treated inhaled allergies like allergy shots for dust and moles. And because of antibiotics, there's one thing is called SIFO, small intestinal fungal overgrowth, because the antibiotics kills the good bacteria, bad bacteria, fungi, molds take over. As a result of that, that causes diarrhea, gas, belching, bloating, diaper rashes, and even neurosymptoms like hyperactivity and so on and so forth. 3 months later, mother reported that sneezing and wheezing are better. She's offered a nebulizer. See, this is the problem. You know, we don't realize that if we have a problem ourselves, we can understand. But when an infant baby or a small child is going through, we may feel it, but we really, it's hard for us to feel what the child himself feels when it's hard to take any breath. Any breath is a struggle, you see. So mother says she used to take inhalers 4 times a day, and look at how much trouble mother has to go through following this regimen. And since on treatment, she has needed only 2 times total. The mother reported as being 75% better. So we're going to talk about environmental allergies. How does the allergy differs than the traditional allergy? If you recall, if some of you have allergy testing done, you do a little scratch on the back or on the forearm, and then in 10 minutes you read it, that's the end of it. But in the environmental allergy, we do a more advanced method of testing called serial dilution allergy testing. You see here, what you do is you take a strong allergy extract and you make progressively weaker and weaker and weaker dilution. Then you start testing from weaker to the strongest dilution. That way we pick up more allergies. If some of you had allergy testing done, you may be told that allergy tests are all negative, because the scratch testing is really very insensitive and misses a lot of allergies. So anyway, so serial dilution picks up practically all allergies. And then when you see we test from the weaker to the stronger dilution, by the time you reach close to a treatment dose, it shows a characteristic wheeling response from where you can find what your treatment dose is, and then you can treat exactly at that level. So it just takes a few injections to reach the maintenance dose, and which is far different than the traditional. When you do the allergy testing, then you do not, you start with a weak dilution. It takes months and years to reach the maintenance dose. Here, within a month, 4 or 5 injections, you reach the maintenance dose, which is a big advantage. Okay. Yes, allergy in infants, yes, they're difficult to diagnose, but the keys are making the diagnosis early, and I'll give you a lot of clues. If you look for those, it'll be very easy for you to suspect allergy as an underlying cause and then move forward. So let's go through some pictures. This is the eczema of the cheeks. This is puffiness under the eyes, typical of allergies. Again, there's some puffiness in the eyes and crying baby. You know, inconsolable crying baby, think about allergies. Same thing. See, angioedema, swelling, that's an acute allergic reaction. And this can be one of the very serious reactions, because in this, you can get swelling of the lips, swelling of the tongue and the throat. And it might be a very life-threatening situation. This is a very interesting skin rash called id reaction. What that means, this consists of little blisters, maybe filled with clear fluid, itchy. You scratch it, it ruptures, and as the fluid touches other part of the skin, it causes more itching. This is again part of the allergy symptoms. Okay, urticaria, hives. Danny's sign. If you see under the eyes, these dark lines, these are a typical allergy symptoms, allergy sign. And this is called the dark circle under the eyes. That's called the allergic shiners. This is allergic salute. Kids with allergies, they may just rub your nose up just because of itching, and also it just opens up the nose a little bit and gives you a better chance to breathe, at least temporarily. And this dark line over the nose, that's again part of the allergic salute, that it causes pigmentation right in here. Okay. What is the earliest age the allergy symptom can manifest? Very interesting question. At any age, even you can show allergies symptoms even in the fetal stage. Mothers may notice that after certain foods, the kid has becomes more active, kicking, or hiccups, excessive hiccups, and intelligent mother can tell that after certain food, and that happens. And okay, number one, you got to, if your infant has problems, you got to look what mother has been eating if she's breastfeeding. So in totally breastfeeding mother, did the mother notice that the totally breastfed baby became extremely agitated or somnolent after certain food that she ate? So that maybe give you a clue for the allergies. How about in partially breastfed babies? By comparing the records of what the baby eats, mother can tell that after certain meals is more irritable, gets running nose, or cough, or it becomes sleepy. The most common problem in infants is allergy and allergy to cow's milk. You see, this is particularly true for if mother forces herself to drink a lot of milk, thinking that eating dairy produces more milk, but which is not true. How do you treat milk allergy in an infant? Well, the standard way is milk substitute. You can have soybean formulas or some other special formulas, but if you use any of those formulas, it is very important that pediatrician should ensure that the baby is getting enough calcium and phosphorus, and the serum calcium and phosphorus and alkaline phosphatase, these three enzymes, three things should be tested to ensure that the baby is getting enough calcium, otherwise going to be deficient in calcium and causing bone problems. Okay. Okay. Number two clue is sleep problems. Many babies sleep 15, 20 hours, By 1 year, they sleep for 13 to 19 hours. By 2 years, they sleep about 14 hours a day. Okay. Hyperactive children, they may sleep only an hour or two and get up and then may go to fall asleep a little bit and then go. So continuous sleep problems, that is a marker for allergies. Some children and babies sleep too much, and they sleep is abnormal. Mother can notice that after they eat certain foods, they just go to sleep. And I'll share a very interesting case study in here. This is the kid. I call him Sleeping Beauty. Why? He was a young boy, 7 years old, good looking kid, very nice kid. He came with the diagnosis of ADHD, and his major symptoms are mood swings, frustration, inattention, being in constant motion, anger, temper tantrums, unable to accept his siblings since the age of 2.5, running nose, stuffy nose, typical allergy symptom, running nose, stuffy nose. Sleeping most of the time since the age of 2.5. Look here, 7 years, and he's sleeping most of the time. So what would happen is when he'll come to my office, he's continually sleeping. I'm talking to the mother, he's continuously sleeping. And he was on 3 mind-affecting drugs: Celexa, Abilify, and Xanax. Look at this, that how these small kids are being made victim of mind-affecting drugs. What we did allergy testing because a runny nose, stuffy nose. So we found him to be allergic to dust, mite, moles. And we did the C4 test, skin testing, found that he was sensitive to candida and related molds. And we suspected that he has food sensitivities. We tested for common foods, found 3+ to egg, 3+ to corn, 3+ to sugar, 3+ to yeast, coca 3+, apple 3+, potatoes 3+, goat cheese 3+. And he was negative on peas, pineapples, and few other foods. And we gave the desensitization for dust and moles, gave him nystatin for C4 small intestinal fungal overgrowth, and for the elimination diet for the food that he was sensitive to. 3 months later, mother reported found food allergy to egg, corn, sugar, cocoa, and behavior has really improved. BJ was unable to sit and stay focused at school. He was easily distracted and ended up in trouble. Mother race is improving like 75% better. See, when you treat the cause, that's what you're likely to expect. Mother further stated he has not been sleeping that much since off the food that he's allergic to. When he got into sugar-containing foods for 2 days, he became extremely hyperactive. And by the 3rd day, he crashed and slept all day in school. You see, a lot of food allergy is really food addiction. We give you a stimulatory phase and withdrawal phase. Most of us don't go to that high stimulatory phase that we become very hyperactive. And in the withdrawal phase, we don't go that much deep down that the mind gets so much depressed that we sleep for a day or two until all the foods are out of the system. Okay, 4 months later, mother reported that he has been off Abilify. He was put on omega-3 fish oils, and mother noticed that his hyperactivity was getting a little bit less. Mother tested him at home for apples, which he put him to sleep for 4 days. It takes 4 days of food to get out of your system, and he crashed on apple. 6 months later, mother reported no more hyperactivity or craziness. He is sleeping well, back to school half days. Allergy seemed to be under control. Mother reported the overall improvement as 75% better. Another thing is babies all smile by the age of 1 month or 2 months or something like that. And some babies may not smile for a long period of time until the age of 3 or 6. And usually it is part of related to food sensitive. So delayed smile is the third thing that you got to look for in kids for allergies. I'm going to stop for just for a minute in here and see if somebody has any questions. You want to raise your hand? I can take the question or write down the question. So let's give a little pause right in here. Okay. I see no hands raised, so I'm going to move forward. Okay. Excessive drooling. I mean, the babies drool, but you know, this is not just drooling. It's just a lake of saliva that comes and soaks the baby or the mother. And some pediatricians have noticed that the saliva stains the clothing, which makes me wonder that what is in the saliva other than just plain saliva. Maybe the allergen that is causing the problem and getting out in the saliva, body trying to get rid of it, you see. Okay, hyperactive children. This hyperactivity is become a common cold of psychiatric illnesses in children, and this is the single most important disorder seen by child psychiatrists, and often put on Ritalin and similar drugs, which is really a terrible idea to do. You got to look for sensitivities. Usually it is a matter of food sensitivities, mineral deficiencies. And most of the time, if you take care of these things, a lot of this hyperactive will improve. Kids will be taken off the street drug, Ritalin, which is amphetamine. Sleeping hard to arouse, that's we talked about that. Babies may be hyperactive. They roll off the table, dislike being cuddled. You just can't satisfy these babies. They may be headbangers or kib rocker. That's a part of the hyperactivity again. Recurrent diarrhea. With the first case, the second case, we talked about the diarrhea because all the food that goes into the gut, obviously. So what's the most common organ being affected? Well, is the gut. And the second thing is inappropriate use of antibiotics in kids in smaller age that causes yeast overgrowth. Antibiotics kill the good bacteria, and bad bacteria, fungi, molds take over. And that is a common cause for diarrhea. Mucus can be examined for allergy cells, eosinophils. And many of these cases that we see with a lot of these digestive problems, they've gone through the whole kind of workup, including pediatric gastroenterologists, and nothing is found. There's scope, but scope doesn't show anything because it's a matter of food sensitivity or yeast overgrowth, which is not going to be showing up on those tests anyway. Okay. Then milk allergy or lactose intolerance. Basically, both things are almost the same thing, but the medical literature tried to differentiate between saying lactose intolerance as a different issue. But in my experience, there's a lot of milk sensitivity also means lactose intolerance. Yes, there are true cases of lactose intolerance, which you can easily see. What you can do is mother can have two formulas made of milk. Into one has lactase and the other one doesn't, a few drops, and see which one caused the problem. If it is just one of those that had lactase in it, then it's the lactose intolerance. Otherwise, it is food sensitivity. Okay. This is another important area, scalded butts. This can be part of the food sensitivity and also part of the yeast overgrowth. And careful record of the foods ingested will provide the answer very quickly. And you see if there's, of course, antibiotics used, then you may like to use antifungal medication like nystatin to help. Constipation and spitting of foods. And these are the two other common symptoms. Constipation is one of the very characteristic symptom of, again, food sensitivity or SIFO. And some babies just don't like certain foods and they will spit it out, and wrongly often is attributed to that the baby is a strong-willed baby. No, it's not a strong-willed baby. If a baby has a dislike to certain foods, don't force that food on. As probably is that's his reacting to that. You see, another interesting part is pyloric stenosis. That's usually typically part of the allergy to foods, especially milk, and that can cause the pylorus, the outlet of the stomach muscle from the inflammation, get swollen and causing constriction, which may even require surgery. But the simple thing, switching the formulas, may solve the problem. You see, infants holding heads and ears. It's hard to say whether they have a headache or earache, but that is, again, a clue that it could be a problem with the allergies. Continuous colic is another very important symptom. You may keep changing the formulas, but nothing seems to work because many cow's formulas and non-cow's formulas often have other things in common, like corn or soybean and other stuff that the babies can react to. In this case, special formulas like Nutramigen and Progestamil may be tried. Okay. Okay. Any infant shifted straight from milk to soybean should be checked. When we take a detailed history, in one of the histories, infancy, if there was a change of formula to cow's milk formula to soybean formula, that invariably gives a strong clue that there could be food allergy problem. And another very important aspect is if baby is unable to tolerate milk and you use special formulas, one thing is very important, that pediatrician should make sure that the baby is getting enough calcium. And the 3 simple tests they can do is serum calcium, phosphorus, and one enzyme called alkaline phosphatase. Alkaline phosphatase is an enzyme that is is produced by growing bones, and if it is abnormal, and then you consider possibly that the kids is not getting enough calcium. Okay. Other clue symptoms: runny nose, stuffy nose, difficulty, and that may cause difficulty in breathing and sucking mother's breast milk or the formula itself or bottle. Okay. And another important thing is one cold after another. This is often one kid's getting one cold after the other. No, I mean, kids get 2 or 3 respiratory infection a year. That's understandable. But more than that, you should think about allergies, especially if running nose is often clear discharge from the nose. Think about allergies. Eczema we talked about earlier. This is again, and we also talked about in both cases that presented that they had a problem with the eczema. Skin allergy, that's commonly allergies to foods and dust and mold. So those are the 2 common things. Will take care of a lot of eczema problem. You don't need to give on steroids. And now, we're in an era where there's so much other drugs that even immune suppressant type of topical creams are being used in infants, which just suppresses the immune system. I cannot emphasize on the importance of treating the underlying causes so that you don't need all those medications, you see. Wheezing, allergy clue symptoms in infants. Wheezing, many allergy infants wheeze early in life. If they get, some will wheeze by itself, or some may have problem with wheezing after a respiratory infection, which may go down to the bronchial tubes, signifying that we call reactive airway disease, means that the lungs are more reactive to than a normal person, so that causes the wheezing and difficulty in breathing. And bad breath is also another important thing. People may be embarrassed. This could be caused by milk and milk allergy or wheat or corn. Maybe the problem right there. Again, we talked about dust under the eyes. Just yeast problem in infants. The role of yeast thrush. If the infant's mother had yeast infection at the time of infant birth, the baby had thrush or recurrent rash one should consider the trial of nystatin suspension. We talked about this is one of the very common problems, either as a result of mother having a yeast when the baby was born, so gets excessive load of yeast, or because the antibiotics were given. So the babies may present with recurrent thrush in the mouth, or recurrent diaper rashes, or continuous diaper rashes, or digestive problem in the form of bloating or vomiting, or seems like that the baby has colic. All these areas we should seriously consider that it could be a yeast issue, and give a trial of nystatin, which is a non-toxic medications. And all you can do is get benefit out of it. If no benefit, no harm is done. So so one should be more liberal in treating these problems. And again, if yeast problem is not treated early, this problem just does not remain limited to digestive area. It can give rise to hyperactivity in kids, or mood swings, irritability, and many other cerebral symptoms, especially in adults or older kids and adults. We see many other cerebral symptoms associated with this yeast in the form of headaches, depression, anxiety, irritability, poor memory, poor concentration, head pressure, mental fogginess, unable to concentrate, and so on and so forth. Okay, so this is, we went over before this. Danny signed these dark lines under the eyes. Okay. So basically, the point in here is that the physicians should be aware of that foods and chemicals at this age group can cause chronic problems. If the baby is not 100% healthy, and it shows, the more deviation it shows from being perfectly healthy and growing, blossoming into a young child and older child. Anyway, along this line, if things deviate, you must think about possibility of allergies and related problems. And many times you'll find those, and taking care of those things will take care of a lot of these problems, and save a lot of misery for the kids. Okay, so let's talk about the symptoms in older children. Behavioral symptoms are some of the most critical ones to look, besides the runny nose and stuffy nose and congestion, coughing, wheezing, rashes, etc., etc. These kids, they whine, cling, say same phrases repeatedly, constantly remove their clothing, become withdrawn or untouchable at times, scream when somebody approaches or touches them, some pull away and say nobody likes me. These are behavioral issues. Pathological laughter, that's a very interesting symptom. Maybe you might have observed or may not, sometimes some people talk smile inappropriately, laugh inappropriately. And sometimes we call this case, this is a silly guy, but that can be a symptom of sensitivity also. Okay. Other children become excessively quiet, irritable, tired, placid, and those youngsters, the correct diagnosis can be missed for many years, just thinking that that's the way the kid is, The youngsters who misbehave, hit, bite, spit, punch, pinch, kick, destroy, or become vulgar are actually more fortunate, because their actions prompt a definite need for immediate medical attention. Here are some of the typical examples. This is a 7-year-old girl presented with tics consisting of cleaning throat, popping hips, popping belly, in and out, twisting wrist, ankles, spanning fingers. And the history revealed eczema of the elbows, knees, ankles, abdomen, and mental history revealed dog indoors, gas stove. We'll talk about the importance of gas stove. Exterminated application inside the house 1 to 2 times a year. And she liked the smell of various chemicals, sensitive to clothing, stating that they just don't feel right. You see, when you have a gas stove in the house, the amount of chemical pollution produced is 300 to 400% more than the West smoke that we talk about in LA, California. And so it becomes a major cause. That's why I especially mentioned the gas stove in here. And when you start becoming sensitive to chemicals, something is very interesting. Initially, you may like the smell of some chemicals like gasoline, or some people say they like the smell of somebody smoking around them. And later on, they start disliking it. Then when you become more advanced, then actually got symptoms. You know, cigarette smoke gives me a headache, or they may say that perfumes give me nausea, or other odors, paint odors cause me to feel dizzy, so on and so forth, depending on person to person. Consequently, okay. So consequently, because she didn't like, and again, these days, unfortunately, our clothing is not the same as used to be before. Even if it's a cotton clothing, there are other chemicals added to make it wrinkle-free, etc. And then we use air fresh. I'm sorry. We use detergents which have chemicals, perfumes, etc., etc. So that pollutes the clothes, especially in chemically sensitive kids. And she was still bedwetting. Again, a prolonged bedwetting is a marker for food sensitivity in kids. Okay. She saw a neurologist who made the diagnosis of Tourette syndrome. Patient was lucky the neurologist didn't recommend any nerve medications. Typically, the treatment consists of mind-affecting drugs like guanfacine, clonidine, so on and so forth. And all older kids may be given more powerful medicines like clonazepam. So it does not help than the big guns, antipsychotic medications like risperidone or haloperidol, etc., may be tried in older kids, but as young as 2 years old. My God, you see. Okay, so we found that she has problem with C4, mineral deficiencies, food sensitivities, chemical sensitivities. We gave her nystatin, minerals. Her RBC magnesium showed that it was only magnesium was 5, normally 6 to 6.5. And she had chemical sensitivity, because the reason she developed chemical sensitivity was because the gas stove is a major source of causing the problem. And so taking care of these things, 9 months later, mother reported excellent improvement, say 75% better. And now my daughter, then she stated on a success story, my daughter began experiencing motor tics around the age of 3. They appeared as continuously touching her face, cleaning her throat, and humming. Tics progressively gotten worsened. Saw a pediatric neurologist who diagnosed her with Tourette. Medication wasn't suggested. In the meantime, she came to us, and we figured out her problem with Candida and other problems. And taking care of these things, that improved and got her better. You see, so what are the take-home points? Well, you can't beat treating the cause. It eliminates your misery and saves money and is affordable. Chronic illness treated with medicines is unaffordable, a major cause for financial distress and death. 250,000 people each year die from proper use of medicine. What does that mean? 250,000 people die not because of wrong administration, but proper administration, because drugs have so many side effects. Focus on treating the symptoms. It is why our healthcare system is failing. Look, all the sick people around you. We have world's number one. We are number one in healthcare, and we are number 43 in health status. That's the Journal of the American Medical Association 2018. So what it means is, in 42 other countries, if we live in 42 other countries, we get a better chance of living longer than USA because of a lot of factors of our nutrition, our environment, chemical pollution, and so many other related environmental issues that have, despite the fact that we are spending a heck lot more money than other people, but our healthcare is not really where it should be. So the key to your future is to be drug-free. Follow your heart, but take your brain with you. For more information, you can visit us right in here. And what I have for you is message of hope. No matter what level of health you are, just believe that you're not stuck unless you're stuck on medicines that you don't want to change. That's the way you want to live your life. Well, that's your own prerogative. I can't tell you anything other than that there's always an option of treating the cause, which is likely to give you much better results than what is possible with any medication. Thank you very much. Can a child with a mild to moderate mold allergy develop a fever after staying in a house high in mold and mildew for 2 days? Certainly, absolutely correct. If a child already has been on immunotherapy for 1.5 years, how would you treat allergies? Very good question. First of all, the question is, how was the child tested? Most likely, the testing was on the back, little scratch testing, or on the forearm. As I said, that gives you, number one, it misses a lot of allergies. And even if the allergies that you find, you don't know what the exact treatment dose is. So therefore, you have to go from what you think was the safe dose, which is very, very low. Then you start building it up week after week after, then one bottle to the stronger bottle, which takes so much time. So what I would do is, we'll do serial dilution allergy testing. Is done right there and then. Within, it may take 1.5 hours, 2 hours testing. But by the time we're done with the testing, we know what the treatment dose is. So it may just take 4 or 5 injections to reach the maintenance dose. And then if you, like for a month or two, if your symptoms are not better, it doesn't matter. You can take the shots the rest of your life. It won't make a difference because you have not, there are some other missing allergies, food or chemicals or yeast or nutrition deficiency or whatever. Okay. From Stephanie. My daughter's hands and feet are severely peeling. Is painful for her. Is exacerbated after swimming, bathing. Any ideas what we should try? Well, I don't know the answer immediately. Chlorine can be irritating. The question is she chemically sensitive that she cannot tolerate that? The second thing can be, is there any, after swimming and the peeling is over with, is the skin perfectly normal, or there is some rash left over which just doesn't go away? So you can pose me that question again. I'll come back to your question when you answer the question I have asked you. Okay, let's see what else we have. Okay, I think that was the last question that I had. Yeah, other